Namaste, good morning. Anshula, how are you?
I'm good.
Nice.
And thank you for coming to our interview.
Thank you very much. Thank to you for inviting me for this interview.
Can you please introduce yourself to our viewers?
Yeah, sure. So I am Siddhant Verma. Just given my final year exams for MBBS, and I am just awaiting the results. I am pursuing MBBS from Guwahati Medical College. Let's see what happens in the coming months.
I wish you all the best for your results.
Thank
and
you.
They will surely come with flying colors.
Yes.
My today's interview is about problems related to sleep in today's day.
Yes.
So my first question will be, what are the most common sleep disorders you come across in people?
Okay, so in my past 4.5 years medical college journey, I have seen many cases in psychiatry departments, in medicine departments. So mostly it is, you can say, 15 to 20 years old teenagers coming with a problem of daytime sleepiness, unable to get the sleep in the night, and then in the school or in the college they feel sleepy. That's one type of problem I've seen. That's also seen with professionals who are working private sectors also. They are also struggling with the same issues, unable to get the sleep in the night, because the night sleep is something which recovers our brain. You sleep in the day, you sleep in the evening, that's not going to fulfill the demand for the sleep. Another problem I've seen is of the hallucinations and deliriums. I've told you, like it's a psychiatric disorder. People during the sleep, in the dreams, they see that someone is killing them, someone is making a plan to kill them, someone is speaking to them that do this, do that. That is one of the problem I've seen in the sleep related disorders. Sleep apnea is one of the main problem now because of obesity. What happens is, due to the fat, the lungs are compressed, so they do not get enough air during the night time. You would have seen people snoring. Snoring is not normal problem, but sometimes during the snoring, people catch their breath, like they hold their breath because of decreased oxygen in the body. So that's one of the main issues related to sleep I have seen nowadays.
How does poor sleep affect a person's overall health?
Okay, so see, overall health includes physical health, mental health, and social health. So, highlighting the physical points, there will be lethargy, unable to focus on the work, tiredness, irritability. The major cause is one of the effect of that. And if you see the children, 15, 20-year-old children, they will not feel excited about their school or any of the activities they are doing because they are not getting the sleep in the night time. Then coming to the mental issues, there will be depression, one of the major cause. As I've said, depression causes a vicious cycle. You do not get sleep, you get under more depression. No sleep, more depression. So it continues. You need to get out of the cycle as early as you can. Depression is there, irritability, and the concentration decreases, attention span decreases. You are not able to give attention to that work. If you require 30 minutes of attention span, that's mental health affected. Then coming to the social aspect, you will not like to meet anyone, you will only stay isolated, like to sleep in the daytime when others are doing their job. You would think, yeah, I should get a sleep, 1 hour sleep, 2 hours sleep. So that's how it affects the social health outcome also. You will get angry if anyone speaks to you. If anyone wants to get some work out of you, you will not help them out.
What are the main causes of sleep related problems today?
Causes include, first cause is this phone, screen time. You see, we are surrounded by screens nowadays, laptops, TVs, tablets, phones, everywhere there are screens. So what happens is, these screens release UV rays, and in our body there is a gland, pineal gland, which controls this sleep related activities. It has been seen that these UV rays affect the hormone which regularizes the sleep cycle. So it is advised to avoid using the screen time 1 hour before sleep. Then another cause is stress. Like we medical students also have seen that we want to sleep, but due to stress we are unable to get the sleep because our mind is always distracted some other work. So we need to reduce the stress. Then the work life schedule of our lifestyle means we work 20 hours out of 24 hours. We are working on the laptop, we are working somewhere, writing something, doing, always busy. We are not giving rest to our body. So that will have its repercussions in the future. These are the major causes of sleep related disorders that are causing the problem. Another thing is the lifestyle. I've said, the fatty food, fast food that we are consuming nowadays so frequently, that these things cumulatively, we might not be able to point out a single factor that these fast foods and burger, pizza are causing on our body, but small causes, and they cause a lot of damage to our body.
How much sleep should an average person get for a good health?
As per the studies, 6 to 8 hours is bare minimum. It is required. 6 hours is required because for the proper functioning of the brain and the body, 6 hours is required minimum. To have a continuous 6 hours sleep is required. And if you can extend it to 8 hours, it's good because of our life schedule and busy schedule. We are not able to get that much, but 6 to 8 hours is good enough. If you are able to manage that, you will be active throughout the day and your whole body will be healthy as well.
What do you think are the natural ways to improve sleep?
So natural ways include yoga. First of all, yoga has lot of health effects, benefits. See, as a doctor, I would advise first to do yoga, then to go for medicines because medicines do have their side effects, but yoga does not have any side effects. So yoga is there. You can do pranayam and many asanas are there. You can follow those to improve the sleep cycle. Other is you can go for a walk in the night if you want. You can induce the body to be tired, get the body tired. So, if you are working sitting on the desk for 12 hours, 15 hours, you go for a 1 hour walk, then you come, wash your legs, and then you sleep. You see the sleep that you will get. And another thing we can do is you can avoid using the phone alarms because we need to keep these phones and screen away from us as much as we can before sleep. 1 hour before sleep, we should set apart our phone, keep apart our phone. No TV, nothing, no tablet, nothing like that. Only you set that old alarm that pops that used to come earlier. Use that alarm. No need of phone because we keep our phones near to us because of the alarms mostly. You keep it away. You use eye bands, ear plugs if you are living in a crowded place. You have multiple family members in the house. You can use that. You use a dark pitch room. Use better curtains, dark curtains, so that you get darkness around that stimulates the gland. That we can do. These are the natural ways.
So, one last question. When should someone see a doctor about their sleep problem?
So, in the first 1 or 2 weeks, I would recommend that we should treat ourselves first. We should try to treat it ourselves by the methods I have told you, like by going for a walk, meditation, yoga, removing the stress factors. We can improve our sleep cycle by ourselves. There is no need for any external intervention. But if we are not able to improve it after 2 weeks, 3 weeks, if we are struggling with sleep, struggling with the activities throughout the day, then we can go for the psychiatric help. We can contact a doctor if we are having serious health issues. Otherwise, we can treat it by ourselves also by the ways I have told you earlier.
So, thank you so much, Dr. Verma, for coming.
Thank you.
It would be a great help for the viewers also.
Yes. I hope this interview helps someone who is struggling with the sleep issues, and we can also apply it on ourselves because we are also sleep deprived.
Of course.
Yes.
And it's need of the hour.
Yes, it's very necessary because if you are not active, if you are not getting the sleep, you will not be active, you will not be able to do anything else also. So it's also very important.
Thank you.
Thank you.